So I'm Cristina Papayannidis, and I'm an hematologist working at the Institute of Hematology in Bologna University in Italy. And I'd like to focus your attention today on a very important topic, which is the management of AML patients with the DNMT3A mutations. And I would like to share with you a clinical case in order to discuss together which kind of approach we may have in these patients. And you can see here in the slide, this is the story of a 67-year-old female woman patient with a diagnosis of DNMT3A-mutated AML with an ECOG performance status of 1 and many comorbidities in her past medical history, in particular hypertension, hyperlipidemia, and type 2 diabetes. So the patient was evaluated by the clinical team, and we decided to treat her with an induction chemotherapy based on the 7+3 regimen, so including cytarabine and daunorubicin, and the patient was able to achieve a complete remission. Then we moved to a consolidation approach with, again, standard chemotherapy based on cytarabine. 2 courses, but unfortunately, the patient developed a very severe infection with febrile neutropenia, very prolonged, during the second course. She maintained the complete remission, but unfortunately, she had a worsening of her clinical conditions due to this relevant adverse event. So the question at that time was how to proceed, how to move on. She is a 67-year-old patient, so not so young, with many comorbidities and with an important adverse event developed during the standard chemotherapy. So we had evaluated this patient at the beginning, considering her fit for standard chemo, but unfortunately, as it may happen over time, the patient became unfit to proceed to an allogenic stem cell transplantation. This is the concept of dynamic fitness. A patient can be fit at the beginning and become unfit over time, and vice versa. So we decided to move to a maintenance treatment because this is a very important breakthrough in AML. Thanks to the results which have been published in the New England Journal of Medicine in 2020, today we have a new tool in the treatment of these patients, which is represented by oral azacitidine as maintenance treatment in those patients who are not able or can't proceed or have no indications to proceed to an allogenic stem cell transplantation after standard chemotherapy. This paper published by Andrew Way demonstrated the superiority in more than 400 patients of oral azacitidine compared to placebo in terms of overall survival and relapse-free survival for those patients who received this drug compared to, as I mentioned before, placebo after chemotherapy. And in addition to this paper, at the last ASH meeting, Dr. De Menezes presented the very important data regarding the impact of molecular alterations in the treatment with oral azacitidine. And in particular, he showed in more than 200 patients that those patients with DNMT3A mutations particularly benefit from oral azacitidine compared to placebo while they receive a maintenance treatment. The benefit was seen in all the subgroups defined by different molecular alterations, but it was particularly and significantly statistically important in this subgroup with this alteration. So this data supported us in proceeding with maintenance treatment. So allogenic stem cell transplant was not performed, and the patient started the oral azacitidine, which is still ongoing. We all know that the drug is usually very well tolerated. Some adverse events may occur at the beginning due to GI toxicity or hematological toxicity, but they are really safely and easily managed with supportive care. So it's not an issue that we can absolutely easily face with in our clinical practice. So the message I would like to share with you today is that for those patients who are not able to proceed to a transplant after chemotherapy, we have an important option. This option is oral azacitidine, and it's very active in all the subgroups of AML, and in particular in those patients with the DNMT3A mutations, but also in others, in particular the SRSF2, which have a very bad prognosis, and this subgroup of patients may have a prolonged survival with this kind of approach.